Hello, I'm Dr. Prolan Malekzadeh.
And I'm Dr. Paisa Malekzadeh.
And we are
Sisters RX.
Thank you so much for joining us. Today we'll be discussing a topic that may affect 50% of you, which is abnormal uterine bleeding.
So what is a normal cycle?
Yeah, so your cycle typically starts on the first day of your period, and your cycle can consist of two phases. So there's a follicular phase and the luteal phase. And then you will go through these different portions anywhere between 21 and 35 days. And then within the follicular phase, you have your period. And so again, that starts the first day of your cycle for that month. And your period will be anywhere between 4 to 7 days. And generally, you may have a little bit heavier flow the first couple days, and then you'll notice that it'll get lighter as your menstruation phase goes on. And so all of that is considered normal.
Got it. So what would be an abnormal phase or abnormal bleeding?
So ultimately, if you are experiencing periods that are occurring more frequently than 21 days, that is considered abnormal. If your periods are occurring greater than 35 days, that's considered abnormal. And then your periods itself, if you're having flows that are lasting less than 3 days or greater than 3 days, all that is unusual, and also how much your menstruation bleeding is as well. We used to measure this. We would define it as like 80 millimeters. We don't recommend that for patients.
Yeah.
We
just how do you know how to figure that out?
So we just trust patients, and they know their bodies, and so if they feel that they're having heavy bleeding, we kind of take their word for that too.
Yeah. So what are some of the causes? Is it like related to age, other factors? What is it?
Yeah, so it really does depend on your age in terms of the most common causes. For example, between the ages of 13 and 18, the most common cause of irregular frequency in your cycles or how long your periods may be is typically because of an immaturity of the hormones that talk from your brain to your ovaries, essentially. And so this is called the hypothalamic pituitary ovarian axis. And so while these hormones are coming on board, there's not this clear communication. And so that's why sometimes the periods may be a little bit irregular, or the length of the period may be irregular. And so that is the most common reason. Now, there's other etiologies for heavy bleeding, especially if a patient's saying that, I have a history of bleeding after I've gotten any work done on my teeth, or my family does. There may be like other conditions going on, but of course, that's not very common. Now, for women who are between the ages of 19 and 39, typically the most common causes of these irregular bleeding is going to be either like fibroids, polyps, and then other conditions like infections. And really the most common reason why patients may be experiencing irregular bleeding is because of a pregnancy.
Oh, you're pregnant if you're not having your normal cycle.
Exactly.
That makes kind of sense, huh?
Yeah, so if you're sexually active and you're not using any protection in terms of pregnancy protection, then you may be pregnant. So definitely do a home pregnancy test to make sure that that's not the case. But that's the most common reason. And then for women between the ages of 40 and 51, which is the average age of menopause, it's actually similar to that the young woman group. So they're essentially their ovarian reserve is falling, and so the conversation that your brain has with your ovaries, it starts to become imbalanced, and so then patients will start to not ovulate as frequently, and then because of that, their periods may be a little bit irregular too. And so those are the most common. In future videos, what we'll do is we'll talk about the most common causes of like structural uterine bleeding. So these are things like fibroids, polyps, adenomyosis, endometriosis. So look out for that video. And then conversely, there are, again, hormonal reasons why patients can experience abnormal uterine bleeding. So we will also have a video talking about the most common, which is polycystic ovarian syndrome. But we'll also briefly discuss thyroid disorders and a condition called prolactinoma, which can also cause abnormal uterine bleeding.
Oh, yeah. So what is the workup? Like, what should I expect when I come to the office and I have these issues?
Sure. So there is 3 components of this workup, and it really depends on your age, your risk factors, and so your doctor will get that information from you. So they'll often ask, are you sexually active? Are you on any blood thinners? Do you have a family history of bleeding disorders, etc.? And so there's the history intake component.
Mhm.
With regards to the physical exam, often you will be recommended to have what's called a bimanual exam. And so this is when the provider will look at the genitalia, not only on the outside, but on the vaginal side, the cervix. They'll feel for your uterus, they'll feel for the ovaries. And depending on your age and your risk factors, they may recommend screening for pap smear, cervical cancer screening. That's what the pap smear is, or check for like STDs like chlamydia, gonorrhea, which can also cause abnormal uterine bleeding.
Mm-hmm.
And so it really just depends on what you've had done and what your risk factors are.
Will it be painful for those of us who have never had this?
So the exam is definitely uncomfortable. I think that when we are doing these very private exams, there's definitely some pressure and some discomfort that's associated with it. The speculum, it does cause a little bit of pressure in the vaginal walls, and that can be uncomfortable. The pap smear can be a little bit uncomfortable, but in general, it's tolerable. And these exams don't take more than a few minutes, so we ask that you be patient with us. And then if you do have, for various reasons, anxiety with these exams, definitely when you're booking these appointments, please let the office know so that they can try to do their best to accommodate as well. But most patients do really fine with it. And
so what do I need, labs or imaging or anything else?
Sure. So yes, typically, in addition to a pregnancy test, if you haven't had that done already, we'll recommend to check for anemia. So there are definitely some blood draws that your provider may recommend. So I'm also often, depending on the patient's symptoms and risk factors, may check thyroid, may check prolactin hormones, androgen hormones. It really just depends on what symptoms are describing associated with the abnormal bleeding. And then also, the provider may recommend a transvaginal ultrasound.
Oh, okay. So is that going to be painful?
No. So I would say that the transvaginal ultrasound is also equally uncomfortable. So similar to the bimanual exam, there's pressure association, but similar to the bimanual, these imaging modalities do not take a long time, and the size of the probe that's used for the ultrasound is a little bit bigger than a tampon. It's not that large.
Oh, okay.
And it's
I didn't
tolerable.
know that. That's interesting. So it's actually smaller than the speculum.
Yes.
Yeah, great.
And so patients often ask, well, why can't I just have like the abdominal ultrasound? And I think the take home message from that is that the uterus tends to be the small parasitic organ in the lower pelvis, and you have the bladder in the front, the rectum in the back. And so when we're trying to look for that organ and the ovaries, sometimes it can be really challenging, especially if a patient has their intestines flowing over it, or if they have a little bit more tissue in their belly. It's going to be harder for us to see. And so if you really want a better imaging evaluation of the uterus and ovaries, the probe being right next to the uterus, which is through the vagina, is going to be really the best option.
That makes sense.
Yeah. So endometrial biopsies we'll talk about in a future video, but that's another workup that you may be recommended depending on your risk factors and age.
Okay. So what is the treatment?
So it depends on what is the cause of the bleeding, but assuming that it's not something overtly abnormal, like a large fibroid, large polyp, or some abnormal thyroid or prolactinoma, a lot of conditions can be managed through ibuprofen, through either progestins, progesterone-only pills, or progesterone-only devices like the Mirena IUDs. Oral contraceptives is another really great option for women. And of course, your provider will talk to you about if you're a good candidate for this, because there are patients who have absolute contraindications to these management options. And so for patients who can't have hormones, or they really don't have these irregular cycles that often, then sometimes something even like a tranexamic acid can be helpful for managing the bleeding.
All right. So what's the takeaway?
If you're experiencing one abnormal cycle, I wouldn't be alarmed. Try to tease out in your environment if there's anything that needs to be optimized from a nutrition, health, sleep standpoint. Outside of that, if you're having persistent abnormal periods and or you're having unusual symptoms, you should definitely see either your primary care doctor or your OBGYN, and they will recommend certain workups, and hopefully we'll get you an answer.
All right. Well, thank you for joining us for another episode of Sisters RX.
where we prescribe clarity in a world of medical noise.
Until next time,
Cheers!
I like that we asked.
It's pumpkin